That will open up the roundtable discussion portion of our webinar. And in addition to Dr. Connell's colleagues, I want to remind folks that we also have with us today Dr. Nadine Gracia, the Acting Deputy Assistant Secretary for Minority Health, and Dr. Sarah Allen from the Department of Education, who's a specialist in education programs. So I would like to invite the participants in the audience now, if you haven't already done so, to send questions through the WebEx Q&A feature or via Twitter using the hashtag LHI. So we do have some questions that have come in already, so let me start with those and continue to go ahead and send in your questions, those of you in the audience. I think I'd like to send the first question to Dr. Wright. This question comes from someone who says he or she is actually very pleased to see the social determinants included as a leading health indicator topic. They would like you, Dr. Wright, to talk more about the significance of having the social determinants included as a Healthy People 2020 LHI.
Great question, Carter. Happy to respond to that. Let me say that the social determinants are in part responsible for the unequal and avoidable differences in health status within and between the various communities. As I mentioned before, the selection of social determinants as a leading health topic recognizes the critical role of the home, the school, the workplace, the neighborhood, and the community in improving health. The Healthy People 2020 LHI were selected and organized using a health determinants and a health outcome by life stages conceptual framework. This approach is intended to draw attention to both individual and societal determinants that affect the public health and contribute to health disparity from infancy through old age, thereby highlighting strategic opportunities to promote health and improve quality of life for all Americans. The Healthy People 2020 vision is a society in which all people live long, healthy lives. And certainly we understand that addressing the determinants of health is critical in our efforts to achieve that goal.
Okay, thank you very much. Dr. Connell, here's one for you and perhaps your colleagues. How do schools and school districts that want to implement First Things First engage the community and get community-level support? And there's a second part to this question. Can you give some examples of how schools or school districts approach this issue?
Sure. I'll just say generally first, and I'd like both Randy and Mary, if they could, speak to it. There are a number of touch points between the schools that are implementing these strategies and community resources and support. One that I'm sure Mary can speak to very eloquently is the family and student advocacy system, which may be the most important connection because that's the connection between the community of families and parents and of the students as with the connection with the school. Other connections are between the small learning communities and the community, as well as the notion that community supports and services could be brought into the school and integrated into the school day itself through the small learning communities and other mechanisms. So, Mary, would you like to speak a little bit to that as well, and then maybe Randy could say something?
Yes, thank you, Jim. And I think some of the, it's different at different levels of development. Now, we've been doing this for 15 years, so our work with our community is a lot different today than it was in the beginning. And as it is with staff, as you start a reform effort like this and an initiative, you have to develop a level of trust. Same thing with students in the classroom, and now with the community. You have to develop a trust with the community. And we did not have a very trusting relationship going on. So there was a lot of conversations that had to be had. We had to look for opportunities to work together. And you can't develop trust if you aren't in the work, is our belief about it. So we identify work that we could maybe go arm in and begin to find some successes with. All of that is a key piece of it. And the family advocacy system that Jim referred to is a critical component and foundation of everything we do. Because it used to be in schools, that only those students who chose to be involved, like in a band or in an athletic team, had that special someone that they felt they could always go to, like a coach or a director, and also that their parent felt like they could go to. If they're having problems in a math class, oftentimes the students in band would go to the band director, or the athlete would go to and the parent would go to the coach to see if they would help them figure out the issue. What we did with the family advocacy system, what we have is that opportunity for every student that's here. Every student has an advocate. The staff divide up the students, and so every staff member is an advocate to students, and every student and parent has someone that they feel like they can go to. Again, a trusting relationship that develops so that as the issues they are dealing with come up, as they have questions, there's a connection that they can have.